Hi, this is my debriefing guide for the clinical judgment simulation for the scenario of the nurse instructing the patient on discharge teaching for mom baby. The first question was concerning the caring that was seen during the scenario. The caring I saw was when the nurse consulted another nurse out in the hallway regarding the patient after she had attempted discharge teaching. In my mind, it was her attempt to solve the problem of the difficult teaching situation because she felt frustrated and wasn't sure how to handle the situation. And although she did go to this other nurse and try to consult with her, I felt like she technically violated HIPAA by sharing the drug use history of this patient with another coworker who, in the scenario, led me to believe she wasn't directly involved in her care. So technically, I kind of considered that HIPAA. The second question, which behaviors were not caring behaviors? I'll probably ruffle some feathers with my debriefing on this part, but I really felt like the nurse dropped the ball when it came to caring. To me, the scenario resembled a situation where the nurse was simply trying to accomplish the task of discharge teaching, and I felt like she was frustrated that the discharging process was not just a cut and dry and get out the door situation. To elaborate on the non-caring behaviors, she appeared rushed to me. She didn't wash her hands to protect the mom and the baby from infection. She came in and kind of tossed the supplies on the top of the patient's covers. When she was talking to the patient, she interrupted the patient's responses multiple times, not allowing for full responses or opportunities to hear the answers to the questions she was asking the patient. She completely ignored the mother's response that she was homeless. Not a, she just didn't address it at all, like she didn't hear it. That was very upsetting to me because if the mom's homeless, the newborn baby is homeless. According to the article we read by Law and John, a lack of education and training has been linked to a lack of sensitivity towards the homeless among nurses. And I could see this playing a part in this scenario where nurses are uncomfortable with situations that they're not educated in or know how to handle. The other signs of non-caring I saw was it seemed like she brushed off the patient's concerns about prescriptions for pain medications. She didn't take the time to sincerely affirm to the mother that the baby was indeed a cute baby. The third question was, how would I respond in this situation? First of all, I would have entered the room and introduced myself, washed my hands, asked about her living conditions and what help and support she had or needed. When learning about the homelessness status of this patient, I would have immediately involved a social worker for further investigation. This mother and newborn obviously needed sheltering and supplies. I would have investigated further her comment regarding the Percocet request and explained to her the prescriptions and expected pain after discharge. I wouldn't have just ignored that and kind of blown it off and put that on her post-op visit because she may not even make her post delivery visit because she may not even make that visit. I would have asked questions, allowed for full answers without interrupting, completed the teaching with verbal instructions along with demonstration to the mother, return demonstration on her part, that is, in a non-rushed manner. The priorities in this scenario, from the patient's perspective, the priorities are getting prescription narcotics for her pain, and also the patient's priority was affirmation that her baby was cute. Neither one of those were really addressed. From the nurse's perspective, the priorities are involving the social services in order to focus on the patient's transportation, lodging, food, and supplies for mom and baby. Really important here is following up on a home visit to assess the mom and baby after discharge. The likelihood of this mother making it to a follow-up appointment with her GYN, and then again for the newborn at the pediatrician for well baby visits and vaccinations, is compromised due to the homelessness of this patient and unlikely to happen unless healthcare professionals get involved. The fifth question, resources that could be offered for this patient. Resources that could be offered for this patient are the social worker at the hospital to act as an advocate to finding lodging and services in addition to the nurse. Getting them set up with Medicaid services for health care can be lined up by the social worker. And there are many places here in my town, Greenville area, that shelter homeless women and children, families, and take care of situations like that. The sixth question, how would I transfer what I learned from the scenario to the practice setting? I would be more conscious of interrupting a patient's response and allow them to fully answer questions. I wouldn't assume that patients have everything they need to properly care for themselves or the baby. And I have been doing ride-alongs with a home health care team for my practicum, and that has really enlightened me as to different home situations. It's easy just to send patients out and think that you have equipped them for what they need after discharge. A lot of times I think we really have no idea what their living conditions are, what support they have, things of that nature, kind of out of sight, out of mind. I was easy to be critical of the nurse in the scenario as far as her cutting off the responses to her questions. And as I made post-op phone calls the day after I watched this video, I had to kind of step back and think sometimes I do the same thing when I'm trying to rush through post-op phone calls because I feel like the patients are babbling. And so I'm guilty of this also. And the video scenario helped me kind of remind me that I need to be careful not to do that myself.